Before we start looking at physical activity across the life course, I just wanted to introduce a document that you're going to be reading this week, and that some of the key recommendations that we're going to look at stem from. And this is a document called Active People, Active Places, and this is a British Columbia document. It's their British Columbia Physical Activity Strategy. This is a strategy that is designed to kind of bring together different stakeholders, different people that have like an investment, not necessarily financial, but like even a caring investment in physical activity within British Columbia. And the goal really, of course, is to improve the health and well-being of British Columbians and the communities in which they live, work, and play as well. Okay, so they focus on active people and active places. So again, this is coming back to that settings-based approach to health promotion that we introduced a couple weeks ago. Okay, so active people, strategies and opportunities that help all British Columbians to be physically active, enabling, right? Health promotion. Active places, well-planned and designed environments that support and encourage active living. So again, this is that settings-based health promotion. So I do want you to read the whole document because it again highlights some of the key important health benefits and other benefits of physical activity. Plus it highlights some kind of key statistics that have to do with physical activity in British Columbia specifically. Plus it looks at some kind of key stats around physical activity in Canada and in British Columbia. So this graph, for instance, graph number 3, outlines how different age groups, kind of the rate of physical activity, or in particular, the ones who self-reported physical activity leisure time, basically across the life course. And you'll notice that with increasing age, we see a decrease in the amount of self-reported physical activity, which isn't necessarily actually physical activity because it's not measured. So these are people that are saying they're getting kind of a certain amount of physical activity, but when it comes to self-reported data, it's often different if we were to measure it. Okay, but the main point of this is that you'll notice that the most active groups are usually the younger ones. Okay, and as we get older, physical activity decreases, and often that's when we need physical activity the most to like maintain our muscle, to maintain our bone, to maintain our independence. And that's why it's so important to talk about physical activity across the life course. Okay, so just wanted to give you this framework. I know you guys are probably sick of frameworks at this point, but welcome to Health Promotion. This framework kind of goes over their kind of big plan, their big ideas as far as where they believe that they should focus their efforts. Okay, and they talk specifically in this document about physical activity throughout the life course, about the key area of equity, which keeps coming up this semester as well, about the key area of supportive environments, which we'll even talk about again later in the semester too. And something we haven't talked that much about yet, but we're going to talk about it later, is this concept of like working together with key partnerships. So for instance, like Participaction or other organizations that are already doing things, but working together to get these things done. Okay, and the mechanisms by which they want to get things done are community design, accessible programs and services, information and education, healthy public policy always comes up, evidence and knowledge development, sustained investments, often through key partnerships, and capacity building too. Okay, so these mechanisms are kind of key to all of that they're going to be doing, and they're trying to build on pre-existing infrastructure. So there's already a lot of organizations in British Columbia that are doing things with activity, but how do we like have more of a coordinated effort and kind of focus our vision and our plan and our efforts towards those that are going to make the most difference? And because of that, they've highlighted some specific groups that they want to target. Okay, as far as their active people, active places plan. Okay, so they're not focusing on adults. Okay, in particular, they're trying to focus on children and youth to get them started young, to get them to build like a relationship and an excitement about physical activity, because they know that children that are active are more likely to be adults and older adults that are active. Okay, and because the need and importance of physical activity increases with age, older adults are a key demographic that they look at as well. Okay, because they are also interested in the concept of equity, and there are some groups, so for instance, those with lower socioeconomic status, those in kind of more remote parts of Canada, new Canadians as well, these often tend to have maybe less opportunities to be active, or in some cases, especially with those with lower socioeconomic status and kind of in remote areas, they just are less active, period. Okay, so we could focus on all those groups, but where do I want to focus my efforts? They want to focus their efforts on First Nations and Aboriginal peoples. And this kind of comes back to that concept of tarpair that we talked about in the target market section. Because remember, the E, tarpair, of that acronym stands for equity. And that acronym, remember, looked at like, how do I focus my efforts? Which group do I choose? And you could choose like the most people, like choose the target group that has the most people. You could choose a target group that's more accessible. You can choose the target group that is more persuadable, or you can choose the target group that maybe needs it the most, okay, or that doesn't have the same opportunities, and that's this concept of equity. Okay, as far as the setting that they want to do most of this work at, they are focusing on the community. Okay, so you'll notice that some of the recommendations that come up from this document are more community focused. Okay, and I like this because it kind of keeps coming back to this idea in health promotion that like it's not about us all working disjointedly on our own, but it's about coming together and bringing together, kind of building those bridges, as we often say, is like breaking down those silos. Okay, so we don't just have all these independent towers working together, but we have this like knowledge translation, this capacity translation, this like sharing resources, this sharing money between these different groups, so we can have more of a coordinated effort instead of just a mishmash of a bunch of different strategies. Okay, so rec centers, caregivers, family members, businesses and employees, people involved in transportation, the environment, of course, healthcare, of course, the government as well, education, like really health promotion, like that higher level health promotion that we look at often has to do with bringing together as much of these people as we can, if they're kind of wanting to do good with us, to kind of get this more coordinated, effective effort out there so we can do a good job.